On the posterior part of the arm, there is a little guy, the anconeus. He starts from the lateral epicondyle of the humerus and only goes a short distance to the posterior proximal ulna, which is slightly lateral to the olecranon process. It is involved in extension of the elbow and is innervated by the radial nerve, and the blood supply is from the deep brachial artery on the radial side. Extensor carpi radialis longus starts at the lateral supracondylar ridge and ends on the posterior dorsal surface, the base of metacarpal number 2, which is this one. It extends the hand at the wrist joint, and it radially deviates and also flexes the elbow, which is an exception. The nerve is the radial nerve, and the blood supply is a brachial and radial artery. Extensor carpi radialis brevis starts at the lateral epicondyle via the common extensor tendon, and it goes to the posterior dorsal base of metacarpal number 3. It also extends the hand at the wrist joint. It radially deviates and flexes the elbow, which is also an exception. The nerve is the radial nerve, and the blood supply is from the brachial and radial artery. Extensor digitorum originates from the lateral epicondyle via the common extensor tendon and inserts on the phalanges of numbers 2 to 5. It extends the hand at the wrist joint, extends the fingers number 2 to 5 at the metacarpal phalangeal joints, the proximal interphalangeal joints, and the distal interphalangeal joints. And there's also a slight extension of the elbow. It's innervated by the radial nerve, and the blood supply is the posterior interosseous of the ulnar artery. Extensor digiti minimi. It originates at the lateral epicondyle via the common extensor tendon and inserts onto the middle and distal phalange of number 5. It extends the hand at the wrist joint, extends the number 5 finger at the metacarpal phalangeal, the proximal interphalangeal, and the distal interphalangeal joints. And it does a slight extension of the elbow because of the origin at the common extensor tendon. It's innervated by the radial nerve, and the blood supply is the posterior interosseous of ulnar artery. Extensor carpi ulnaris originates at the lateral epicondyle via the common extensor tendon and also the posterior middle 1/3 of the ulna. It inserts on the posterior base of metacarpal number 5. It extends the hand at the wrist joint and ulnar deviates, and slight extension of the elbow because of the common extensor tendon. It is innervated by the radial nerve, and the blood supply is the posterior interosseous of ulnar artery.